Well, let's take a further look at the issue of access to treatment by persons living with HIV and AIDS. And I'm now being joined by the Global Fund Implementation Advisor of the United Nations Program on HIV and AIDS, Mr. Richard Amenia. Thank you for joining us on News at 10.
Thank you very much. It's a pleasure to be here.
Well, statistics from the UN reveals that 160,000 AIDS-related deaths occurred in Nigeria for the year 2016 alone. I mean, what can be done to reduce this figure?
Sure. Thank you very much. 160,000 people dying of AIDS in Nigeria in 2016 is very unfortunate. And that translates to about 440 people dying on a daily basis. So that is a huge concern, and because Nigeria has the second largest epidemic globally, and it is important that we try and reduce deaths. Even though we don't have cure for AIDS, there are drugs that can save people's lives, and clearly when people have access to these drugs, those people will not be dying. And what we need to do, basically, is to identify people who are infected early and then ensuring that they have access to these life-saving drugs that are available in most public hospitals in the country. And then also maintaining them and retaining them on treatment such that they will be virally suppressed. What is important is that currently, as we speak, about 64% of Nigerians who are HIV positive do not know their HIV status. Only 34% know that. And so we have a lot of work to do to identify people who are positive, and be able to refer them to care and treatment. As we speak, about 1 million people have access to antiretrovirals in Nigeria. That is huge.
But from what you have gathered, really, on the issue of hidden service charges on antiretroviral drugs, how widespread is this practice in government-owned hospitals?
Well, user fees mainly are usually government-sanctioned fees, and that is supposed to help hospitals generate some internal revenue to be able to do some of their running costs and all that. And so they charge patients in order to have resources to provide other related services and also ensure quality of services. But unfortunately, persons living with HIV, most of them are poor and are not able to access this. They don't have the resources. So, and if you see, the UN is talking about having equity and leaving nobody behind. And so because of this, it is important that government is able to do something about addressing the charges that are becoming red tapes or barriers to accessing.
But what can the UN do to increase access, more access to antiretroviral drugs?
Basically, what we are doing is to bring out the barriers of people having access to these drugs. And next week, there's going to be a World Health Assembly, and the Executive Director of UNAIDS, together with the Ambassador Bex of PEPFAR, are raising this issue of user fees that is becoming a barrier. The point is that you have Global Fund and PEPFAR that are investing significantly into saving people's lives. These drugs are in the hospitals. And so if you have user fees becoming a barrier to people having these drugs, then don't be surprised that you have about 440 people dying on a daily basis in Nigeria.
Well, I'd like to thank you very much indeed for coming to join us on News at 10.
It's a pleasure to be here. Thank you.